Now we begin our discussion on prostate. So we start with the discussion of your lower urinary tract symptoms. Now they are divided into your two broad groups, which are symptoms of voiding and symptoms of storage. So what are your symptoms of voiding? It includes your hesitancy, poor flow of urine, intermittent stream, dribbling, or sensation of poor bladder emptying, or episodes of your near retention. On the other hand, your storage symptoms include your frequency, nocturia, urgency, urge incontinence, and nocturnal incontinence. So this basic topic has been asked a lot of time in your exams as a multiple choice question stating which of the following is a symptom of voiding and which of the following is a symptom of storage. So please do remember this lower urinary tract symptoms. Now this has replaced the term prostatism, right? So your symptoms of your prostate can be actually classified as your lower urinary tract symptoms, further subclassified into voiding group and your storage group. Now we move on to the next important segment, which is your bladder outflow obstruction. So what is your bladder outflow obstruction? So these are your low flow rates in presence of your high voiding pressure. So if you look over here, this is your normal flow rate. So the voided volume is well in excess of 350 ml and the maximum flow rate is in excess of your 25 ml per second. Whereas if you see in this below diagram, now it is showing you a low flow rate, right, for a volume of a less value, that is around 200 ml. So now what causes this bladder outlet obstruction? So the various causes includes your benign prostatic hyperplasia, bladder neck stenosis, bladder neck dyssynergia, bladder neck hypertrophy, prostate cancer, and your urethral stricture. In this section, we will be mainly focusing on your BPH and your prostate cancer. So what is your effect on bladder? Now the flow rate. The normal flow rate is more than 200 ml of voided urine with a peak flow rate of more than 15 ml per second. Now it becomes low when it is less than 10 ml and it is said to be equivocal when it is between 10 to 15 ml per second. Next is your voiding pressure. The normal voiding pressure is less than 60 centimeter of water. Now a high pressure is said when it is more than 80 centimeter of water, and equivocal pressure is said to be in the range of 60 to 80 centimeter of water. Now, so what are the long term effects of this on the bladder? So the bladder may decompensate, as a result of which there is a detrusor contraction which becomes less efficient. Because of this, your residual urine develops, right, leading to your chronic retention. Next, the bladder may actually become more irritable during filling with a decrease in the functional capacity, partly caused by your detrusor overactivity. So these are your long term effects on the bladder leading to your chronic retention. Now what are your complications of it? So if you see, acute retention of urine is sometimes actually your first symptom of your bladder outlet obstruction. There would be chronic retention. So the residual volume is more than 250 ml. So the tension in the bladder wall is going to increase. There is going to be a large volume of your residual urine and increase resting and filling bladder pressure, a condition which is known as your high pressure chronic retention. Now this increased intramural tension results in your functional obstruction of your upper urinary tract with the development of your bilateral hydronephrosis. So the increased intramural tension is eventually going to lead to the formation of your bilateral hydronephrosis. Also your impaired bladder emptying. Now if the bladder decompensates with the development of a large volume of residual urine, urinary infection and calculi are prone to develop. Then there would be development of storage bladder symptom secondary to BO that can be irreversible if BO is not treated. Then there could be hematuria. Now, this may be a complication of a BPH, which is a benign prostatic hyperplasia, and other causes must be excluded by carrying out your urine cultures, cytology, computed tomography, and urography or cystoscopy. So, this were your complications and effects of your bladder outlet obstruction. So, now coming down to the next segment is how do you assess these patients of your LUTS? So, I have taken this important table from your Bailey and Love. So, your investigation would be your essential investigation that includes your urine analysis by dipstick for blood and leukocyte esterase, glucose and protein. Then you have urine culture for infection, serum creatinine and urinary flow rate and residual volume measurement. Then you have your additional investigations which include your PSA if indicated and your pressure flow studies. Right. Now, regarding your pressure flow urodynamic studies, these are done in order to definitely know regarding the voiding pressure as we had discussed. Now, regarding the urinary flow rate measurements, the upper tract imaging in form of your ultrasonography or a CT scan and a cystourethropy. So, this are your few of the important techniques that is used to assess your lower urinary tract symptoms. Right. Now, in the next videos, we shall be discussing the specific benign prostatic hyperplasia and your prostate cancer.